Good morning. This is Malik, Malik Khan, licensed acupuncturist, nutritionist, and herbalist from the UK, who has the honour of interviewing my colleague and good friend from Australia, whom I had the pleasure of meeting at a seminar in Melbourne, Dr. R.J. Singer from alchemywellnesscentre.com.us. Welcome, R.J.
AU, Australia.
Okay, AU. Okay.
Thank you for having me.
Great stuff, RJ. Great stuff. Now, you've got an extensive background in TCM medicine. You're a doctor of Chinese medicine. Amazing. I looked at your bio, and it's amazing what you've done. Now, you've got a treasure trove of tools and expertise that can help people get better. Today, if you don't mind, I'd like to put you in the spot, okay, and ask you about a condition which one of my cousins, whose cousin's son who suffered for many years, and he hasn't had much success with Western medicine. And I don't know whether you might know much about it, but it's very difficult to pronounce it. It's ulcerative colitis. I don't know if you've heard of that condition, RJ.
I know a lot about it because I had it myself and have cured myself of it. And that was really how I got into Chinese medicine in the first place. I started back when I was 24 with some strange symptoms of urgency to go to the toilet, and blood started appearing with the stools, and I started getting really worried about it, but ignoring it. And then eventually I found out it was ulcerative colitis. And
did you have weight loss as well?
Yeah, I'd have severe weight loss and fluctuations in weight. Sometimes I'd have to take prednisone or do like particular enemas with prednisone, and also take mesalamine, which is a drug that is pretty much like aspirin for the intestines. It just kind of reduces the inflammation a little bit, but it doesn't take care of the problem. And the prognosis, ulcerative colitis.
Would you be passing out a lot of stool?
Yeah. So at first, when I first started getting it, it felt more like painful constipation, and my stools looked funny, and wasn't sure what was going on. Then when it started getting worse, it would turn into like frequent diarrhea, like 10 times a day. Painful, feeling like shotgun in my stomach, and I'd be irritable, and it was terrible. The prognosis.
RJ, this is amazing. These I've never spoken to you about this before.
Yeah.
And what you're saying is exactly what was described by my cousin's son. Is literally everything you've said. Amazing.
Mm-hmm.
Amazing.
It's getting more common, and it's getting more common in younger people. It used to be known as just like a disease that started in your kind of late 20s or early 30s, like when you're first just starting out in the world, or even older, like in your 50s. But now I have a patient actually that is 8 years old with it, which is very young.
That's crazy. That's sad. That's sad. It's starting at such a young age. I mean, it's and the person I had in mind, I think it was in his teens, stroke early, maybe 20s. But amazing. Yeah, it's quite frightening, shocking.
Yeah. So allopathic medicine doesn't have very good options for it. So they're pretty much the ones that I already mentioned were corticosteroids and mesalamine, some sulfa type drugs, but really all it does is kind of mask the symptoms, and then they expect you to have a higher risk of bowel cancer, and most often they will cut out and remove part of the bowel, or even to the degree of having a colonoscopy bag, which did not sound good to me when I was 24 years old when I first heard that. So I tried a lot of different things. First, I ignored it just like anyone probably would, and just went on with my life and didn't agree with it. And then the symptoms started getting so bad that I couldn't ignore it, especially the weight loss. And then I tried, researching things online myself. How could I treat it a natural way? And took all these supplements, went to a naturopath, went to a vitamin store and tried everything, and none of it worked. And then I found a Chinese doctor, a very famous one in Santa Barbara, California, who's now deceased. Henry Han was his name. And he made up a formula for me. And within 1 month, I felt the best I'd felt almost my whole life. I couldn't believe how good I was feeling. And I got really interested. And I asked him so many questions that he kept, he really kind of started mentoring me and getting me interested in studying Chinese medicine. That was how I first started.
Okay, interesting. Okay, so you treat this condition, and it can be treated.
It can be, and I often get very good results with it. I would say 90% of the people that have come to see me and follow through with everything that I all my tools for about 6 months will see significant change. Most of them go into remission. And that is confirmed with colonoscopy.
Okay. And did you, with your that doctor you saw, Henry Han, did you get the formula from him?
No. Well, he gave me my formula, but as you know, in Chinese medicine, there isn't one formula for everyone. So it depends on, like, the symptoms are the same, but the cause of it is different. So every person that comes in is unique, even though there's some similarities, like I can expect certain things, and we do treat it in stages always. So the first priority is to stop the bleeding. So we use herbs to stop the bleeding. Second is to reduce the inflammation. And inflammation is just all the waste that's just building up and not getting out of the body. So we have to somehow get rid of those toxins out of the body. A lot of it's heavy metals, glyphosate poisoning, lots of different reasons why there's so much inflammation in the body. And there's always tends to always be an emotional component too, where people hold a lot of emotions inside, maybe have a lot of stress. That is one of the triggers, and that's recognized in allopathic medicine as well.
Okay, so stress is a factor, but so from your gut feeling, what do you think? Why are we getting such an increase of these sort of conditions, or this particular condition anyway? Was it the food or the air, or?
I think it's a combination of a lot of things. It's pollution for sure, an increase of heavy metals in the body. A lot of that's from agribusiness, from industrialized agriculture, herbicides, pesticides, increased use of glyphosate is a big one. That's why we see so much gluten intolerance now. It's not actually, like, gluten is obstructive and it's gluey and sticky, which, it's hard to move out of the bowel, but it seems to be more the cause of glyphosate poisoning, because
So for someone that's a layperson that doesn't understand glyphosate, what is that, and how does it come into it?
Glyphosate is a herbicide. Its common name is Roundup, and most grains, especially wheat, farmers will spray it with glyphosate Roundup to quicken desiccation, and desiccation is going to seed. So they can harvest nearly a month earlier than they would without using it. And what happens is that poison, that herbicide, will concentrate in the seed, and that's what we're going to use as a flour or as a grain. On top of that, when they put it in silos and store it, they add things to keep out weevils, things with like aluminium, a lot of aluminium in it. So again, more heavy metals. In addition to that, we've got microplastics, we've got increased additives, food coloring, and now the new threat, genetically modified organisms in our food. All of these things are increasing inflammation and toxicity in our body, and really messing up with the gut microbiome.
Oh goodness! So it's quite frightening. So the good thing is that you can help, especially Chinese medicine can help. So how would you, somebody comes for this condition to your clinic, what do you just use acupuncture, herbs? When do you use what?
Yeah, that's a good question. So herbs are always a must. They're probably the most crucial element of the treatment. And they have to take it every day, 3 times a day, for minimum 6 months, and sometimes for a year or longer for maintenance. And like I said, we treat it in stages. So the first part is to stop the bleeding and reduce the inflammation, get rid of the toxicity. Then we're trying to balance the gut microbiome and put it back into balance. They're either, in terms of Chinese medicine, the prevailing most dominant patterns are either true heat, fire toxicity, or dampness. It could be cold damp or damp heat. Damp heat tends to be the most common type. So that means that the gut microbiome is like a hot, wet swamp, and the things that are growing in there, the organisms that are growing in there, love a hot, wet environment. So there are things that are like mold, fungus, yeast, bacteria. They're growing out of control. Even though all of the good bacteria is still there, they're just outnumbered because they can't thrive in an environment like that. So the herbs, they don't just kill the parasites or kill the bad bugs. They actually change the environment inside the gut. They get rid of the dampness. They cool down the inflammation, or if it's a different pathology, they do something different. Another interesting thing of one of the causes that I think of why it's increasing is the rampant use of antibiotics, not just overprescription by doctors, but in the meat industry and in the fish farms. So they're just pumping these animals full of antibiotics, broad spectrum antibiotics, which then goes into our food, and that's just causing lots of killing of our gut microbiome and causing these imbalances.
Gosh, there's a lot to it, isn't it? My goodness.
And my second tool, of course, is acupuncture. The nice thing about acupuncture is it can really deal with the flare-ups and the acute symptoms. So the acute pain, the tenesmus, the urgency to go to the toilet, the irritability, the stress, the frustration, all of that, you can almost get an immediate response from the acupuncture. But of course, the effects of acupuncture vary from person to person. It could be, a matter of only a few minutes of relief, but most commonly it's a few hours up to 4 days. And with that, we, in the way that I work, we usually do a very intensive acupuncture, and we go month by month. So maybe 3 times a week for the first month, combined with the herbs. And we, of course, address diet and change the diet and address their unique imbalance and give them a medical diet according to that situation to change it. And then Qigong is another aspect that I think is important. But not everybody has the patience and the self-responsibility to do that. And I find that that's one of the best ways to deal with the root cause of the problem. But the other things are very important at first, because we need to get rid of the acute symptoms, or you're not going to feel good enough to even attempt to do Qigong and meditation and breathing exercises, and even change your diet, really, because you feel so terrible. In fact, most of the people have been suffering so long with these diseases, they don't even know how bad they feel until they start feeling better.
Okay, so someone comes to your clinic, you start them off with acupuncture the first week, and then when do you apply the herbs? The following week or the next month?
No, we actually start herbs on the first day.
Okay.
For this condition, always. I've just seen it so many times. I just know how to treat it. I say, hey, we got to give it at least 3 months, more like 6 months, and you'll see a difference. Of course, if we don't see any change within 3 months, then I'll probably refer them to someone else. But that's only 10% of the cases I've seen that we haven't seen much of a change. Most of the time, there is a change, even if it's not as significant as we'd like. According to blood tests, reactive protein has decreased tremendously. There's a lot less inflammation in the body. They're feeling much better. There's no more bleeding, but they may still have flare-ups on occasion, maybe once or twice a year or something like that. But usually the flare-ups themselves, they're not even that bad. They're maybe just, they notice a little bit of blood. Again, I in most cases, they improve dramatically where we get them into remission. That's the hope.
Okay, great. So you give them acupuncture, you give them herbs, you give them some exercises to do, qigong, and diet as well. What main diet things would you advise them?
So again, it depends on the pattern according to Chinese medicine. So if it's a true inflammatory excess heat type of condition, these are the type of people that are kind of wiry, stringy looking people, whether their veins and are showing through their skin, and they're very active people, and maybe their eyes kind of bulge out a little bit, and their faces are red. Usually with those ones, we need to cool them down. So a vegetarian diet is actually very good for them, but it needs to be, it's not forever. It's like for 6 months or something, just to get rid of the inflammation. For all types of ulcerative colitis, it's very important that everything is cooked. So we can't have any raw food, any cold, and no cold food. So nothing out of the refrigerator. This slows, because the stomach needs to be 1 degree warmer than the rest of the body at 37 degrees. And it's trying to unlock, kind of cook things like a soup inside your body to unlock the nutrition from the cellulose. So even in a laboratory where you look at vegetables or food and you see like a raw vegetable, it will have a lot more nutrition than a cooked vegetable or a cooked any type of food. But the problem is that the nutrition is locked away inside. You have to cook it to release it. So either you cook it outside of your body or you put it in your body and your body has to cook it. When your body has to cook it, it's expending energy to try and get the energy out of the food. And a lot of times with a cold, raw type of diet, you're actually expending more energy than you're getting back. You have a net loss in energy. And over time, that makes the digestive system worse and worse and worse. And then what occurs is gut dysbiosis. Usually in Chinese medicine, that can be dampness or true inflammation. So if with that true inflammation, true full heat type of condition, maybe vegetarian for a while. If it's a damp, cold damp type of pathology, then we don't want to be vegetarian because that's too moistening of a diet. So it's going to make the bugs, the bacteria, yeast, fungus, all that grow more and get more out of control. And often, I see all types of people like ulcerative colitis. It's not just like heavy meat eaters or people with poor diets of eating frozen foods and TV dinners and things like that. I see a lot of people that actually think they're eating quite healthy, eating, they may be vegetarian or vegan and eating what they consider to be very healthy diets with a lot of fresh foods. But the problem is that something is out of balance in the body. So we need to change it and address it. For the damp heat type, which is the most common, and I'd say it's 60% of almost everybody that comes in through the door, whether they have ulcerative colitis or not, they probably have a damp heat type of condition. And that's, like I said before, like a hot, wet swamp inside. And that is mostly from our Western diet, meat, potatoes, not eating. The one thing that all the diets have in common is eating a lot of vegetables. And then we kind of change it a little bit. So for the damp heat type of diet, we want a very drying diet, but we also want to cool it down a little bit. But the most drying type of diet is like a ketogenic diet, where we stop putting sugar into the body and try to make the pancreas stop producing insulin and start producing glucagon. That makes it a fat burning machine instead of a sugar burning machine. And in Chinese medicine, that's a very drying type of diet. So if somebody was you know, the first example I gave, if they were really wiry and dried out, the skin looked really dry, that would be an inappropriate diet. We wouldn't want to dry them out further.
Yeah, excellent. A lot to it. You touched on supplements. What supplements would you recommend, or would you recommend for them to take? For example, do you probiotics? Are they necessary or not?
For the most part, they're a waste of money.
Okay.
The reason being that the stomach acid is your first line of defense to keep all these microbes and microbial organisms out of your body. So when you eat anything, it's going to get into the stomach acid. Stomach acid is going to burn it up. If you take a probiotic, most likely it's going to die in the stomach acid. And if you don't have a prebiotic, which is a food source for them, they're most likely not going to get into the gut. Even if you give a prebiotic and you get it into the gut, the environment in the gut isn't conducive for that strain of beneficial bacteria, so they're not going to thrive. In fact, that strain is probably already existing in the intestines. And the only reason why...
Hi, Jay.
It stopped for some reason.
That was a condition. Okay, hi RJ. We're continuing with our discussion we had, a very interesting one about ulcerative colitis. RJ was explaining his background, how he got into this medicine, and how he's able to fix himself up. Now, we're talking about different sort of ways of treating this condition, and RJ was touching on supplements and why they're, to a great extent, in many cases, a waste of money. Is that right, RJ?
Yes, the prebiotics in particular, I think are. So I already explained that because of the stomach acid and the environment of the gut microbiome not being conducive to those beneficial bacteria, is that they're not going to really grow. They're not going to do anything by taking them. Now, there are a couple of strains of probiotics that under research have shown to have maybe some positive effects. They're not huge confirming studies that show that they really do, but there may be some possibilities. But when we look at microbiome kind of science, especially from an allopathic point of view, it's a very new science. Really, it's only been going on for about a decade. And saying that you need a particular type of bacteria probiotic for a certain condition is kind of like saying if we just add a butterfly to the environment outside, everything's going to get better. Now, if you want to use, like, say, for Crohn's or ulcerative colitis, there's a couple strains of probiotic bacteria that have shown in some studies to have some effect. If you want to add them in, I don't say don't, but let's do it a little bit better. Let's try to make it work a little bit better. So what I say in that regard is make some homemade sauerkraut. And when you make the homemade sauerkraut, you break open a capsule of that probiotic, you put it in there so it actually grows in the sauerkraut. And then when you eat it, it has a better chance of actually getting into the gut. But again, you still have the same problem of the environment not being conducive to that bacteria. And a lot of times what you will see, and a lot of people that have these type of conditions, or even just IBS that hasn't been confirmed as something severe as ulcerative colitis or Crohn's disease or anything like that, they may notice that every time they have sauerkraut or fermented foods, they feel really sick or nauseous or have weird symptoms. And that's because the good bacteria and bad bacteria are fighting each other. And then it's producing gases and from the metabolic actions of those bacteria. So you have to build up as well if you're going to use something like that. You can't just take large amounts every meal.
Okay, great. So sauerkraut is a possible one, adding those probiotics that may help
I just say if you really want to use probiotics, then that's the best way to use it. I'm not saying they're necessary. And in a lot of circumstances, I would prefer them not to have it because they will have so many bad side effects from the fermented foods that I would prefer, if you're going to add that into the diet, to do it much later after we get rid of the inflammation and kind of start getting the gut microbiome back into balance. Then you're going to have more benefit. Usually you have more things like that people would consider to be Herxheimer reactions if you are having the sauerkraut and the probiotics. The only other supplement that I may possibly prescribe is liver capsules. The only reason being is that liver is very high in lots of micronutrients, and we don't eat organ meat regularly anymore, whereas our grandparents did, and it can be very beneficial. So you don't have to have liver capsules. I really encourage people to get all their nutrition and their medicine from plants and animals, from food sources. Part of that is because vitamins, minerals, they aren't very absorptive in the body in that form. They really need to come from a plant or an animal source. Otherwise, we could just eat soil.
Yeah. Or eat plastic as it is nowadays, you know. It's okay, so the key things are the acupuncture helps, the herbs are key. How often would you be prescribing the herbs? Would it be every week or every month?
So typically we go 2 weeks so we prescribe the first day, and then we see them again in 10 days to 14 days. And we want to make sure that it's working properly. We may alter it a little bit. And they may stay on that formula for maybe 4 to 6 weeks, and then it usually changes again. So like I said, it treats it in stages. So the first most important thing is stopping that bleeding. A lot of times, one of the other issues with this disease is because of the blood loss, people become anemic. They become really tired and fatigued. They can't think very clearly. Some people can't work because of all these things. And also, you know, having to go to the toilet 10 times a day, and the fear of not making it to the toilet, that's a real thing that people live with. Some people, their whole lives are affected. They can't work, they can't go on holiday, they can't go anywhere. So that's another thing. We want to stop the bleeding first, reduce the inflammation, and get them to not have so many frequent urgent bowel movements.
Okay, so you're looking for them to have that relief. So RJ, okay. So RJ, great. That's great to hear that you have great success, up to 90% with this condition. It's amazing. That's wonderful. I'm sure a lot of people listening will be very, very happy to hear this. So you were saying about, so they'll need to come in often, every 2 weeks, and you'll reassess them. So as well as looking at their, for example, symptoms such as this, the bleeding has reduced, and other conditions, do you look at anything else? For example, do you look at the pulse? Do you look at the tongue? So,
primarily the pulse. So the pulse tells me everything. So I'm a student, long-term time student of Jimmy Chang's Pulse Synergy. He's created an amazing, very, very accurate pulse diagnostic system, along with his system of prescribing herbs from a Taiwanese Fang Jiafang style. So I can tell from the pulse exactly what's wrong and what needs to be done, and that's how we change the herbs. We want to see the symptoms improving fairly quickly, and the pulse is going to take a little bit longer, but when we need to see the pulse change. If the pulse doesn't change, it's going to come back even if you feel better, because the imbalance is still there. In addition to that, you know, I use a few other diagnostic tools, the ears, the palms, the face. I don't use the tongue very often because I find that the tongue only shows the most acute symptoms. And that can be confusing sometimes when you see everything else.
Yeah, brilliant. Now you mentioned about the pulse and this particular system. I think that's quite unique among most, if not all, acupuncturists that you have.
As far as being good at the pulse, that's true. It used to be the most important aspect of diagnosis in classical Chinese medicine, and it should still be today. The problem is that there just hasn't been that many masters that have authentically taught a system that works. And that's what's amazing about Jimmy Chang, is he's very open with sharing that information really, really openly and freely, without the typical master discipleship type of relationship.
Okay, great. So which particular, if I was to show you my hand, where would you put, what are you looking for on the pulse? Which pulse are you mainly looking for?
So each wrist is a different part of the body, different organs and organ systems. But the radial pulse comes down and it hits the scaphoid bone and kind of goes over, right? But when it kind of comes up the hill, hitting the scaphoid bone, it reverberates and makes a vibration. And that vibration can be felt in 3 pools along the wrist. And these 3 pools will tell me what is going on in the body. So you have to first know what a normal pulse feels like, which isn't that common, actually. Most people don't have normal pulses. But when you know what a normal pulse is, then you can know what a pathological pulse is. So when we say pulse, it's more than one pulse. There's many pulses that we're feeling. So just in this upper area here, we call it the Chun position. On the left wrist, this is the heart and small intestine. But we can also feel the carotid artery over here. We can feel arthritis in the one point here. If it shows up, it's either there or not there. Then we come down to the liver and gallbladder and nervous system, and then the sexual hormones, adrenals, that sort of thing. Then on the other wrist, we have the upper respiratory system, like the sinuses and eyes and all of that. And then we've got the lower respiratory system, which is the lungs. And we've got the pancreas and stomach here. And then we've got the actual kidney organ, as well as the upper back, where the channels associated with that connect. So we can feel a lot of information.
Okay, a very sophisticated system. Amazing.
Very sophisticated. And this isn't really reinventing the wheel. It's been around for thousands of years. It's just that Jimmy Chang's a genius at teaching it and explaining it to people, to where we can actually mostly astound people when we do a pulse diagnosis. We can say, hey, you've got this, and this, and 90% of the time we're right.
Okay, so with ulcerative, I can't even pronounce that name. Damn, it's coming out of my mouth. I'll call it UC. So with UC, which particular pulse are you looking for? Which one are you looking for?
Okay, so there's a large intestine pulse, a small intestine pulse. There's the stomach, pancreas, and the liver and gallbladder. And actually, almost all of them are involved because this is a complex disease. In fact, it's one of the reasons why I enjoy treating it so much, not just from my own personal experience of having it, is that it almost has every kind of pathology in Chinese medicine wrapped up into one. So you can feel, in some cases, you feel for the large intestine, and you want to know if there's a lot of inflammation there and it's really jumpy, you know that there's an issue. And the small intestine, so if it's Crohn's disease, the small intestine will probably be affected as well. Whereas in ulcerative colitis, really just the lower GI tract is affected. But when the small intestine is affected, you can feel that in the pulse. And there's always a liver, gallbladder, nervous system aspect to it. And then you can also feel the pancreas function and the gut microbiome. Is it too damp? Is it too hot? Is it too dry? And then there will be an element of adrenal fatigue usually, because the inflammation has been going on for so long. The body has been using up so much energy trying to fight a hidden enemy that it just cannot do. So what it does is the body thinking that it can trap this pathogen or this hidden enemy of in the body, which is just a lot of garbage and pollution and parasites and bacteria, fungal yeast, mold, all that kind of stuff. It tries to heat up the body, but it's like it closes the doors and windows on a house and tries to heat it up. In a lot of cases, it's using a lot of energy to do that, but it's hiding everywhere in the body. So there's inflammation not just in the large intestine; it's in other places as well.
Yeah, it's you're right. I mean, it's very complex, and I'd say it's a great gift that not nice to say, but you had it and you've dealt with it and you can treat it and you are treating it and you do get excellent results. That's anybody listening, amazing. They're very lucky to come across yourself, and that's great, RJ. So you have an all-round experience of herbs, nutrition, qigong, exercise, supplements if they need it, looking at their lab works as well, and you're approachable and you have a very good sort of like I mean, I've been to myself some doctors, physicians, and they're very abrupt and not very caring, and they want to get rid of you as soon as possible. Some are pretty arrogant, and especially when you're ill, you're going for some help. There's one occasion I remember I drove about 4 to 5 hours to a place, and it's just horrible at the other end. But anybody listening, and I've met you, and they're very lucky, and they should get on the phone straight away to you. You're one of those 1 in a million acupuncturists, herbalists. So great, RJ. It's wonderful talking about this condition with you. I know you also deal with other conditions as well, but maybe we can save that for another time. Anything else you'd like to add, RJ?
I'll just add that people can find me in Byron Bay, Australia. That's New South Wales. And my website is alchemywellnesscenter.com.au. And you can send me an email. I am quite busy, but I always try to reply to every email I get. Sometimes it's not as timely as I would like, but I do address them all eventually.
Brilliant, excellent. So, my geography of Australia is not wonderful. The New South Wales is towards the north, is it?
New South Wales is the east coast, and Byron Bay is the easternmost point of Australia. So it's kind of in the center and furthest east.
Okay, brilliant. Okay, lovely. Okay, so and your website again was alchemywellnesscenter.com.au? Correct. I got it right that time. Excellent. RJ, thank you very much for being on the show today. It's wonderful to hear about this serious condition, and it's amazing that you are around to be able to help people. But thank you very much.
Thank you so much, Malik. It was a pleasure talking to you, and thank you for all the kind words.
Thank you.